So the first attribute of the olive leaf is its ability to enhance immune function. Pretty amazing. Next, it reduces plasma glucose while reducing tissue damage in laboratory animals that are exposed to high glucose levels. In other words, you take a mice or a laboratory animal, create them diabetes in them, give them olive leaf, these animals show less tissue damage. And so that translates to us as less blindness, less kidney failure, less heart disease, less nerve damage. All from olive leaf. Pretty amazing. Olive leaf is rich in vitamin E and various phytochemicals such as beta-cytosterol that lower cholesterol. Okay? Lowers blood pressure significantly, both systolic and diastolic. This is a summary of the physician's desk reference. Excellent reference for all of you wanting to learn more about herbal remedies. It has a powerful antioxidant blend of flavonoids. And one of our breakthrough concepts that so many of our brilliant researchers help us to understand, these flavonoids, the magic of plants, that's how they prevent heart disease, cancer, the neurodegenerative disorders, the Alzheimer's disease, and olive leaf is richly abundant in these flavonoids. Improves clotting factors. You know, this is the explanation. We know people who eat a lot of fruits and vegetables have less trouble with blood clots, and this is one of the reasons. The magic components of the olive leaf and other plants too. Antifungal, this is right out of the PDR, very helpful in chronic yeast conditions. Antimicrobial, antiparasitic, anti-inflammatory activity, very helpful for chronic fatigue and psoriasis. Those of you struggling with psoriasis, you know how hard that is to treat. You're tired of the steroid creams and the powerful injections that can cause leukemia? You know the medicines. You know, they're very powerful. And there's a place for them, but try a little olive leaf. You might get remarkable results with it. How about chronic respiratory allergies? And this is where we have heard from our practice in supplying olive leaf to so many people, the amazing testimonials. In particular, the chronic sinus, the fungal sinus, the chronic sinus, the allergies, the asthma. That's where olive leaf gets the gold star. Top 5 type of supplement. Okay? All right? Who should take olive leaf? Well, chronic viral syndromes, you know, the chronic mono, cold sores, recurrent colds, shingles. Great herpetic activity with the with the olive leaf. Chronic fatigue, the chronic yeast, and diabetics come to mind with the chronic yeast syndrome for diabetics. The respiratory conditions, allergies, chronic sinus and asthma, that's where we get the gold star for olive leaf. Skin conditions, boils, rashes, menopausal, hormonal problems, definitely bladder, kidney, urinary problems. This is what ails us, folks. Oral infections, anemias, detoxifications, gout, heart patients, high cholesterol, hypertension, cancer patients. It's often used as a longevity agent. Anyone wanting a natural antibiotic. Now that's a long list, so I want to give you the 5 things that you may want to commit to memory where olive leaf really shines. Number 1 is a chronic viral problem of any type, chronic virus. Number 2 is chronic sinus with allergies. Number 3, chronic fatigue syndrome. It's often caused by a viral syndrome. Yeast situations, and if you're struggling with cardiovascular disease. Those are the top 5. Virus, sinus, chronic fatigue, yeast, cardiovascular disease. Okay?
That's a great one.
Yep.
Richard, that's amazing. That's just a whole
is.
wide variety
It's
of
biblical.
symptoms. And
it's biblical. I mean,
you know,
think
I
about
didn't know it helped gout.
Yeah.
You always think of cherry extract for gout, which is good, but I didn't realize olive leaf was that good for it.
This is a theory, but the connection could be the yeast. We know that yeast can make uric acid as a mycotoxin. We know that. That's been proven in the lab. So if you're overwhelmed with yeast, you're going to run a little higher uric acid level, and of course that leads to gout.
Oh, I mean, and gout is so
painful.
painful.
You can connect the dots.
Yeah.
You can.
Yeah.
Well, how do you do this? Well, you can take the olive leaf right off the tree if you're fortunate and live in California or in Israel or someplace, you know, where it grows naturally. You dry the leaf. You put 2 teaspoons of that crushed leaf in hot water, let it seep for 20 minutes or so. You know, you make tea out of it, and you do that 3 or 4 times a day. If you don't want to fuss with that, you can just take the capsules, okay, where all that work has been done for you. Now, what do you look for? As with all our supplements, you want to look for standardization. That means that they are checking every batch for purity and quality. Standardized oleoropin, remember that's the active component, one of the active components. 12% standardized oleoropin is good. That's a good product. 18% is exceptional quality, and 20% is the gold standard. So if you can find the 20%, you're getting your money's worth. You have value in that supplement. That's what that means for you, okay? And of course, that's what we have achieved to do, and we accomplished that. We got the 20% standardized oleuropein. 1 to 2 capsules, 500 milligrams daily. That's a good dose. It's a good way to start.
You know what's great about olive leaf, Richard? I mean, it's one of those supplements that you really don't feel anything when you take it. You just sort of begin taking it on blind faith, that it's going to help my nutrition, and then all of a sudden you realize, hey, I didn't get a cold.
Right.
I'm just feeling better generally.
Right. I'm slowly getting better.
Yeah.
Better, better, better. And that's the whole point of it. No side effects that we're aware of.
Yeah.
You know, if you can eat olives, you can have olive leaf. Pretty much it. Well, folks, let's go to our break, and maybe when we return, we can talk to some of our viewers. You're next. Join us.